Now, in the meantime, let's shift focus and get you another update. This is with regards to the concerns over Nipah virus that has been reported from West Bengal. 2 cases have been reported with 2 nurses testing positive for the infection. However, the health officials confirmed that both of the patients are stable and undergoing treatment at designated medical facilities. Authorities state that no fresh cases of Nipah virus have been reported in the last 20 days, indicating that the spread remains under control. However, there is active surveillance and contact tracing that continues, with the health teams maintaining close monitoring in areas that have been identified. Officials have urged citizens to follow precautionary measures and avoid panic, reiterating that the situation is being closely tracked by the health administration. Let's connect with Isha on this. Isha, 2 cases, however, have been reported, but precautionary measures, what is being said that needs to be followed? And of course, there is no situation to panic.
Right, Amita, that is what the health ministry has been reiterating, that there is no need to panic because the 2 cases, the 2 nurses who tested positive are also now stable, and 196 contacts were traced, which were linked to these 2, and all were found negative. So there isn't much to worry about, is what the health ministry has been saying. In fact, these 2 particular cases, they have been reported in West Bengal, and this is since last December. In fact, this is NCDC data. The health ministry has also advised that there is large reportage. Some sections of the media are stating that the number of cases have increased. However, it is all false. It is all a lie. There are only 2 cases, and as of now, there is no spread of Nipah virus.
Right. But, when we speak of what the authorities have been saying, that the spread, however, remains limited, but there is a high fatality rate that has been demanding a lot of caution, Isha, and an awareness, and especially when it comes to the early need for medical attention.
Definitely, Amita. Nipah virus needs a lot of awareness and needs a lot of education in the youth, especially considering of how fatal it is proven to be in other parts of the world. And currently, there is nothing to worry. There are only 2 cases. But again, the need of the hour is for everyone to be aware and for everyone to know how they can protect themselves. So definitely, there are more advisories need to be issued, and how it spreads. There needs to be more information in the domain by the health ministry.
All right. So the WHO has also assessed the Nipah virus cases in India, however, has said that it is at low risk and travel curbs, however, are not needed. Let's listen in.
On 26 January, India notified WHO of 2 confirmed cases of Nipah virus disease in West Bengal state. As of today, no additional cases have been reported. The 2 cases are in a health facility receiving supportive care and didn't travel while symptomatic. No cases have been reported in any other country associated with this outbreak. Indian health authorities are implementing outbreak control measures, including enhanced surveillance, laboratory testing, contact tracing, patient management, and strengthen risk communication and community engagement. Nipah is a serious but rare disease. It was first reported in 1998 and since then has been reported in limited occurrence in Bangladesh, India, Malaysia, Philippines, and Singapore. The virus usually transmits from infected bats, fruit bats of the Theropus genus, if you're interested, and other animals like pigs to humans through direct contact, consumption of contaminated fruit of food products such as raw date palm sap. WHO will continue to closely monitor the situation in India and other countries, regularly continuing to assess the risk and provide technical support to local health authorities as needed to ensure time.
Well, that's the WHO, which has sought to reassure the public over India's latest Nipah virus outbreak, saying that the risk of the spread remains low and there is no need for any travel or trade restrictions following the confirmation of 2 cases being reported in the state of West Bengal, as being reported in North 24 Parganas district, which has seen Nipah outbreaks in the past. So let's connect with Rajesh on this. Rajesh, what is the update that we are learning as far as when it comes to the containment of the spread of the Nipah virus is concerned. We are told that the situation is under control. Last 20 days have not seen any single case of the Nipah virus being reported.
Yes, absolutely. We spoke to some higher officials of Health Department of the government of West Bengal. As for the sources in Health Department, there is no fresh case reported in last for 20 days in the state of West Bengal. There is no spread, which clearly indicates that the spread has been stopped in the state. And right now, there is no fresh case have been reported. Initially, two nurses were tested positive with Nipah virus, after which they were taken to hospital and they were admitted in the hospital. They were undergoing treatment, and following which they are currently at stable conditions. Right now, in last 20 days, there is no fresh case of Nipah virus. The situation is completely under control, and surveillance is being done on behalf of the Health Department as per the sources of Health Department in the state of West Bengal. Back to you.
And what is now being said, Rajesh, as precaution now is concerned, because the WHO say that there is no need for any trade or travel restrictions. However, concern that still needs to be growing as far as if somebody needs urgent medical attention, and awareness that needs to be spread over the outbreak of Nipah virus.
Absolutely. The government of West Bengal is conducting several awareness campaign to make people aware about this Nipah virus, and a team was constructed by the authority to spread more awareness to the people, because initially 2 to 3 people were infected with this virus, and following which on behalf of the Health Department, several camps were made across the state to people to make awareness to the among the common people regarding this virus.
So as a precaution, several countries in Asia meanwhile have stepped up airport and border health screening measures, including temperature checks and health declarations for travelers that are arriving from regions near the outbreak. Rajesh, for the moment, thank you very much for joining in. Back after a short